Hi all, welcome to NCLEX Matter. Today let's deal with one of the cardiovascular system topic, that is endocarditis. Endocardium, this is one of the layer in the heart. So endo means inner and cardio means heart and itis means inflammation. So endocarditis is the inflammation of the inner lining of the heart, and this occurs primarily the clients who are IV drug abusers, have had valve replacements or the repair of valves with the prosthetic materials, or have other structural cardiac defects. Moving to the assessment, itis means inflammation, so definitely fever will be there, anorexia will be there, fatigue, cardiac murmurs. This condition is related to the heart, so definitely cardiac murmurs will be there. The contracture feature of endocarditis is splinter hemorrhages, Osler's nodes, and Janeway lesions. So, splinter hemorrhages which occur in the nail buds, and Osler's nodes, that is reddish tender lesions on the pads of the fingers, hands, and toes. Janeway lesions, that is non-tender but hemorrhagic lesions on the fingers, toes, nose, or earlobes. Apart from this, splenomegaly will be the clubbing of fingers will be the. So, what we can do for this? The intervention starts with the positioning. This is the client to a comfortable position, in the sense sitting up and leaning forward position. And if oxygen fall is the administer oxygen, administer medications, that is analgesics, salicylates, NSAIDs, digoxin, antidysrhythmias, uh, antibiotics, and monitor for the complications such as thrombus, heart failure, and cardiomyopathy. Apart from this, adequate rest is required, balanced with activity in order to prevent the thrombus formation. Maintain anti-embolism stocking. There will be a chance to for the emboli. So maintain anti-embolism stockings. Monitor for the signs of heart failure, and there will be chances for splenic emboli, renal emboli, pulmonary emboli, like that. So for the splenic emboli, sudden abdominal pain will be there and is radiating to the left shoulder, and rebound abdominal tenderness on palpation. And for the renal emboli, flank pain radiating to the groin, and apart from this, hematuria and pyuria will be there. So splenic emboli, abdominal pain radiating to the left shoulder. For the renal emboli, flank pain radiating to the groin. For central venous system emboli, confusion, aphasia, and dysphagia will be there. For pulmonary emboli, pleuritic chest pain, dyspnea, and cough will be there. And the skin, on the suspend of skin, petechiae. So this is the skin for skin and mucous membrane, in conjunctiva for the petechial rashes. Then this is for the Osler's nodes on the pads of fingers, toes, or ear, nose, or earlobes. Evaluate the blood culture results, administer IV antibiotics, and plan and arrange for discharge. So, what about the client education? Teach to maintain the aseptic technique during the administration of antibiotics. If the patient is getting discharged and if they are continue to take these antibiotics in home, means teach them to maintain the aseptic technique. Instruct to administer the antibiotics at scheduled times. Monitor the IV catheter sites for the signs of infection. Record temperature daily up to 6 weeks and to report fever. Encourage oral hygiene at least twice a day. Avoid the use of oral irrigatory devices and flossing to avoid bacteremia. There will be chances to get infections, so avoid the oral irrigatory devices. Teach to cleanse any skin lacerations thoroughly and apply an antibiotic ointment as prescribed. Inform all healthcare providers of history of endocarditis. The patient shall have to inform the doctor regarding the history of antibiotics if they are going for any prophylactic antibiotic prior to invasive respiratory procedures and dentistry. Teach to observe for the signs and symptoms of embolic condition and heart failure. So this is all about endocarditis as in the view of NCLEX. Thank you.